Corona.
There you are. Can you hear me?
Yes, I can.
Oh, there. I don't know what happened before.
Yeah, I'm not sure, but we got you now.
Yep.
Is there any echo or anything
No, I don't
in the
hear any.
background?
Are we? Is everything centered okay from your end, or with our camera and everything?
Yeah. You're good. You're
Okay.
good. You're good. So let me go here. Great to meet you, by the way.
You too.
Yes. All right. So take your mind into the wonderful world of physical, emotional, psychological, and spiritual wellness. Ladies and gentlemen, welcome to the Kinetic Hour. Conversations with you and guests. With your host, Kenan Wesley Mason. All right. Good morning, good afternoon, and good evening, and welcome to another edition of the Kinetic Hour. I am your host, Kenan Wesley Mason. Welcome one, welcome all. Thank you all for tuning in. It's always great to have you. As always, go to my YouTube channel and subscribe. It's the Kinetic Hour, and that is Kinetic, Kennetic, the Kinetic Hour. Subscribe. Click the notifications, leave your comments, click thumbs up, share the videos with everyone that you know, as we are streaming live on Instagram, streaming live on Facebook, and streaming live on LinkedIn. So welcome to all three platforms. Whether it's one person listening or 1,000 people listening, as always, my voice will continue to permeate. And as you can see, I have my guest here, and I'm glad that he's here. I'm just going to read this real quick. He's known as the doctor for depression, being a family practice physician for 3 decades. He's treated tens of thousands of patients for neuro-chemical imbalances, teaching patients and doctors about this vitally important topic. He's devoted his whole practice to treating problems with mood as they relate to physical problems. He's not only treat depression, but also anxiety disorders, bipolar disorder, ADD, headaches, neck and back pain, fatigue, insomnia, fibromyalgia, irritable bowels, as well as the host of other stress-related conditions. He's the author of a 3-volume series called Healing the Mind and Body, and his latest book titled The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide. 30 years in the making. And again, I'm glad he's here. Let's welcome to the Kinetic Hour, Dr. Paul Corona.
Well, thank you so much for having me on. I appreciate it.
Dr. Paul, thank you for gracing the stage with me here on the Kinetic Hour. I'm happy to have you. I've gone over your website. You have a lot of information, and I have a bunch of notes that I've taken down here. But I want to start from the beginning with you, going back to the beginning and how you got started and what was your journey and what led you to choosing this profession for yourself?
Well, going back to medical school in the latter '80s, I really liked different subjects: pediatrics, psychiatry, OBGYN, adult medicine. I kind of just didn't really know what I wanted to do, so I chose family medicine because I thought it'd be the best, mixture of things to work on and keep things interesting. So I did it after medical school. I did a 3-year residency program in downtown Los Angeles. Um, and then I started. After that, I left for my practice in South Orange County ever since then. What I discovered really in the early '90s, at the time we had a few what we call SSRIs. Everyone's heard about Prozac, but Zoloft, Paxil. But then I started seeing with new medications coming out in the 1990s that they not only help with mood, but they also help with pain. And that has to do with different chemicals that they were balancing besides just serotonin. And so I started seeing this connection between mood and the body. And I started seeing people say, yeah, not only is my stress down, but my headaches are gone, my neck, my back, my stomach, my chest, my this, my that. So I started really seeing a connection and I was shocked that I wasn't reading about it. I wasn't reading about it in textbooks. I would read psychiatric textbooks and journals and go to seminars and try to figure out why am I not hearing this? And when I'm asking doctors about it, why are they looking at me like I'm crazy or something? What are you talking about? Anyway, during the 90s, I started really understanding how to treat depression, anxiety, physical symptoms. Then I delved into bipolar disorder and got really interested in that. So it really was a kind of an evolution in my practice during the 1990s. And I got so busy that about the year 2000, I had to make a decision because I just couldn't do everything anymore. I had to make a choice, and I was realizing that I was making a bigger difference doing this than I was being a family doctor. So I had to make a decision to break away and go into this full time. And a couple of years later, in 2002, is when I got to the point, like 10 years into my career, that I need to do something about this. I still am not hearing about it. I'm still frustrated. Why aren't doctors picking up on this? So I started writing my first book, Healing the Mind and Body, and I didn't realize how much of a journey of writing that was going to start. I started writing, and then after about 4 years, I had 800 pages of material. So I decided, okay, this is really a 2-book series, and so then I started working on the second book, and that became another 800 pages. And I thought, okay, well, that's too much for one book. I'll make it 3 books. So it became a 3-book series of over 12 years of writing, 1,200 pages. And now let me just quickly, and then we'll go back. Let me just quickly say after that, I started writing 2 books because I decided I want to start teaching doctors. So I wrote 2 books, my 4th and 5th books that I'm currently editing and working on to release this year. And I finished those training manuals before I started writing the Corona Protocol, because in the Corona Protocol, what I wanted to do is tell stories. Since I'm a fiction reader my whole life, and I'm always interested in storytelling. So I decided to make this book really different. I tell 30 original short stories about people that suffer with different types of conditions, and so now after 23 years and 6 books, I think this is my end of my writing now this year for a while at least. It's enough.
Yeah. I mean, 800 pages here, 800 pages there. That's a lot of information.
Yeah.
But it's great. Now, specifically, what made you go into depression as a focus? Because from what I've seen over the last 2 decades, we hear of so many people having complaints of depression, whether it's manic depression or, there's so many. Matter of fact, I have, just for my own references, I bought the Diagnostic and Statistical Manual, and there's so many different diagnoses in here, and it's grown over the decades, from like a 35-page pamphlet to, I think it's over 900 pages. This is the 5th edition here. What is it about depression that made you want to go into that as a focus, and why do you believe that depression, so many people are, quote, suffering from depression and anxiety too, why do you believe so many people are suffering from these 2 conditions more than ever before, it seems, in history?
Yeah, I think we're talking about it more too. I think it's always been around in previous generations. It just got hidden in like alcoholism, and my grandpa was a big drinker and my grandma was a nervous lady, and so it's been for a long time. It's been since time began, really.
Yeah.
But it's just there's more focus on it because we live in a stressful world. The pandemic made everything worse. Yeah, so my interest is not, yes, depression, anxiety, not just depression. It all kind of goes together. Why is it? Why does it happen? Why is people not getting the help they need? Well, I think by and large, doctors just aren't that great at treating it. The reasons why why people get these conditions, number one is genetics. We got to look at family history. mom, dad, grandparents, siblings. So usually, when I take a really good family history, you're going to see mood disorders in the family when someone has one.
Hmm.
Number two, sometimes certain times of life, like puberty, is usually a bad time for mood. So middle school, menopause, for women, postpartum for women, menopause for men, midlife, and stressors, trauma, all these things kind of come together. And these things do is they throw off the balance in the nervous system. And simply put, medications just put the chemicals back on track again. That's all they're doing. They're reestablishing connections. The challenge in this field is people understanding that this is a medical problem. And especially hard with men. Men have a more difficult time dealing with it because I'm not a pill person. It makes me, they don't want to display signs of weakness. Women too. It's just the acceptance that there is a medical treatment for this, and that you can find it with blood tests and scanning. And so people want answers. And they say, well, I want to see on paper what's going on. Well, I can't show you on paper. Well, what I do is I show people neurons and draw diagrams and explain, okay, here's what medications are exactly doing. So I try to make it visual for people so they understand exactly what this is about. But that's, the acceptance of people wanting to treat it and accepting treatment. And as far as, why is it so bad? Because I think that there's a lot of doctors out there. Most of them really just don't know how to do a very good job treating it. Whether it's primary care doctors, whether even with psychiatrists,
Hmm.
a lot of incomplete treatment, a lot of people get a little bit better. That's it, and they think, well, that's it. And I have to live the rest of my life feeling like this. Yeah, you do. You will feel like this long term unless you treat it properly. And that's
Hmm.
where I've learned my methods basically are different, and the Corona protocol is a different way of doing things as compared to the old psychiatric model that is, in my sense, in my opinion, kind of old and tired.
Mm. Yeah, yeah. And you mentioned some of the factors. I'm going to put this up on the screen because you just mentioned a couple of them just now.
Hmm.
I'm going to put this on the. I'm just going to put this up real quick because you mentioned genetics, and this is coming directly from your website. You mentioned genetics, or your genes,
Hmm.
as it comes from generation or generational patterns,
Hmm.
and hormone and body chemistry, and upbringing and lifestyle. Now, can you talk about specifically upbringing and lifestyle and stresses? I watched my brother go through a lot of these scenarios. He was diagnosed with paranoid schizophrenia,
Oh,
and I've over the last 2 decades I've seen him take some of the medications that you mentioned earlier. Lexapro, Cymbalta, Seroquel. Um, but can you go back and can we kind of specifically go into some of these here? Because a lot of people really don't realize where their depressions come from, their anxieties, their paranoias about the way of the world, um, upbringing, and lifestyle.
right.
Can you talk about those for a little bit?
Well, because every new patient I see, I ask the question during the visit: when did you feel the best in your life? If you can go back to any age range of your life, where would you go and why? Number one answer, and there's two answers that are most common. Number one is probably childhood, like elementary school. Why? Because it's a time of life where we play with our friends. You don't have a lot of worries in the world. We don't have a lot of stress in our lives. The other answer is usually like late teens, early mid 20s. Why? Same reason. More carefree. You party, you have fun. Before maybe the responsibilities of life hit you, and more responsibilities. So as far as upbringing, now the upbringing, the elementary school is if you have a functional and healthy parents. So if you have a good upbringing, you feel safe, you're not abused, you're not neglected, that's a good upbringing. But some people don't have that upbringing. Some people have a pretty rough upbringing, and so they don't even know what normal feels like. I hear it all the time. People say, "I don't know. I don't remember a time I felt great in my life." So my job is to teach them how to, or basically my job is to get them there, and that's what I do with my medications and how I do things. If your brother has paranoid schizophrenia, there must be schizophrenia somewhere in your family, maybe in previous generations, I'm
Mm-hmm.
guessing.
Mm-hmm.
And as far as, I exercise, yeah, I mean, I talk to all my patients about, I'm not just about medications only. I talk about lifestyle and, regular exercise that helps with stress, learning how to relax, learning how to breathe properly when you're stressed. So all that is part of it. Getting counseling when you need it, if you have trauma. A lot of people have PTSD, and there's a lot of people, a lot of women, especially some men, have sexual trauma from when they were young, which is really digs deep, and it's really difficult to get past that. So, yeah, so there's a lot of reasons as far as why upbringing is not often the best time of life. But that's all the stuff I talk about with my patients. Is that my goal is to get them to where they feel great every day, they're happy, they're not stressed, and I'm able to do that with pretty much almost every person. And the way I work is I work very quickly. The old psychiatric model, well, we start at SSRI and then we do this, and it'll take like 4 to 6, 8 weeks to work. That's nonsense. Um,
Right.
and they all this message is bad messaging because it's not true. The right medication should take no more than a week, maybe two at the outside to work. And so basically, the psychiatrists move very slowly. I move very quickly. I'm able to
Mm-hmm.
get people fully better usually within 2 or 3 visits. And it usually means combining a couple of medications together, sometimes 2 or 3 medications together. Sometimes it's easy as just one. But I'm looking at each chemical, dopamine, GABA, norepinephrine. I'm trying to figure out what's imbalanced, what I can do to balance these chemicals properly so the person feels amazing and looks forward to living and doesn't feel hopeless anymore and despair and all the things people feel when they think that I'm stuck here. I'm never going to feel better. That's why suicides happen, is because people lose hope and they think that I just can't live like this anymore, and so they take their lives. And
Mm-hmm.
um, yeah, so it's really serious. It's a serious business. That I have a huge responsibility with patients to make sure they get better. And I also have really I pay attention to my customer service. Every new patient is at least a good hour with the person, getting all the history. I ask every patient to call me a week later. No charge, just a phone call, just so I can check. They can check in, and because I can tell within 1 week if I made the right choice or not. And if I did make the right choice, okay, maybe I adjust the dose. If I didn't make the right choice, I stop it and go to something else. But see, if I keep the lines of communication open with my patients, they know that they can get a hold of me. Which is not common in the doctor world, by the way. For doctors to actually talk to you over the phone in between visits or call you back, it's pretty unusual. But I
Mm-hmm.
do that because I'm trying to establish trust. I'm trying to get people to understand. Look, I'm going to get you there. It might take a little bit of trial and error. I might pick the wrong thing before I get the right thing. I just have to figure out how your body works, but I'll get you there. I can assure you I will. I always do. But that's so. If I think just giving people hope and to explain to them that you're not going to get stuck like this. It's not your fault that you feel like this. The reasons that this happened to you, you have no control over. So what we can do is put you in control. We can make sure that you're really feeling your true self.
Mm. Yeah, feeling your true self, and you talk about how your patients, when they what you say about your pain is the first clue to a solution. So so when patients come to you and they start to tell you all their stuff, you can kind of narrow things down fairly quickly according to how they're explaining their symptoms to you. Is that correct?
Absolutely. It's all based on history and family history, symptoms. So when people come and tell me, I ask them, how's your body feel? And they say, oh yeah, my neck, my shoulders, my back. And constantly, especially these muscles right here, are being tight. My massage therapist spends all their time here in these muscles, head, neck. So when I see physical symptoms, and then you realize that they're related to stress, but they most of the time they are, then that tells me a lot, and that helps me to choose what to give the person in order to resolve not only the stress and the anxiety, but also the physical symptoms. And it's different. I mean, people say, well, what's normal stress? Everyone has stress. We all have stress in our lives, and we feel sad at certain times. When you have an anxiety disorder or clinical depression, it's different. It's more pervasive. It's more persistent. It's not something you can just easily pull out of. It's something that just really affects you on a daily basis. And when people tell me, I just am not my old self. I just don't feel like the old me anymore. That's a signal that this is definitely a treatable condition.
Mm.
So as far as what made it worse, like I said, time, stress, the pandemic was a disaster. How it was managed was a disaster, and so shutting down businesses, shutting down schools, all this stuff that was this nonsense stuff that was happened, and that didn't help the situation. Because then you have people isolating more, and people losing their livelihoods and their businesses they worked so hard for. So it was just a bad time during those years too.
Hmm. Yeah, it created a lot of stress for a lot of people over the a 3-year period almost.
Yep.
Um, I started in massage therapy. It's funny you mentioned that
Oh
because
yeah.
I started in massage therapy back in 2002, 2003, and you're right. The this specific area right here, when you start to stress and that chemistry is released from the brain, this is where it resides first, and then it starts to build and contract and build and contract, and then the muscles become hard as rocks.
Right.
So I do understand that from
Yep.
that position, um, being in massage therapy off and on for almost 10 years. um, and you also and you talk about the physical chemistry, because we can't really see social anxiety disorder under a microscope, or you can't see bipolar 1 or 2 under a microscope. But like you said, you can show the chemistry that's fluctuating, the neurochemistry, um, and you talk about the mind body connection. Um, why are so many people disconnected from that? Because the mind body connection kind of is the starting point of getting oneself back in order, if you will.
Right.
So why has there been such a disconnect?
Well, I mean, again, the mind-body connection means that everything is flowing properly through, because the nervous system goes everywhere in the body. And just briefly, it's composed of over 100 billion nerve cells we call neurons, connecting to other neurons, and chemicals are flowing around the body at about 1,000 times a second. Um,
Yes.
there's over 100 trillion connections between the cells we call synapses. So everything is going very fast at a microscopic level, but we can't diagnose it, through a microscope, because it's a living system. So if you took the nerves out and just look at it in a microscope, you're not going to see it happening there, because it's dead tissue you're looking at. So
Yeah.
um, so so we know how the nervous system works, and we also know how things go off track. And so all medications are doing is rebalancing what's there. They're attaching to the nerve cell. Basically, they're fixing leaks. Is what's going on? Leaks on the cell membrane that causes disruption of the flow. So I'm basically like a plumber. I'm fixing leaks all day. And so that's and so I don't know if that answers your question or not.
Yeah. Yeah. Because so many people, if not most people, um, they don't understand the quote mind body connection, and how the brain or mind is connected to the rest of your physical body. And so we kind of we don't know where these behavior symptoms are coming from, or behavior patterns. And so when we get diagnosed with, well, in my brother's case, it was paranoid schizophrenia. Um, but other people, bipolar,
Hmm.
disorder, uh, and any other general anxiety disorder. Um, Now we have here in America, I don't know how it is on other parts of the world, but here in America, we have the quote opioid crisis, and so many people become addicted to certain medications that are prescribed to someone that has one of the many disorders that have been identified. Um, you have come up, or you have discovered certain medications that aren't so addictive or not addictive at all. So how do you differentiate the two, and so that we, the public, can be assured that if I start taking medications at your recommendation, that I won't become addicted?
Well, again, the medications I work with are not addictive because they're the balancing agents, like I said, the antidepressants, the mood stabilizers, and then people might say, well, they work and the person's feeling really good, and how long to be on them for? Well, we're not sure about that yet. Some people are able to stop it after a year or so and be okay, but a lot of people have just taken longer term, and people might think, well, how is that an addiction? Because every time I stop taking them, I feel like crap again, and I tell people, well, look, if a diabetic stops taking their insulin, they don't feel very good. They do very poorly, actually. If a thyroid medication is stopped, then the person feels really tired. But those things are taken long term. There's a lot of things in medicine that are taken long term we don't think twice about. And people will take supplements and vitamins long term, not think about that. And so it's just a matter sometimes of people realizing that this is a cure. I call it the holistic solution because it helps the body heal itself. And then a lot of people will think, well, holistic basically means herbs and supplements and vitamins. Well, that's one way of looking at it. I look at it differently. And then as far as what are the addictive things that to watch for, I call the band-aid medications. Like, I mean, opiates have their place, post-surgical pain and certain chronic pain. And if someone, doesn't abuse it, they're appropriate for certain people. I don't prescribe pain meds, but in my world, you got Xanax and Valium and tranquilizers and sleeping pills. So I do prescribe those here and there when people have panic attacks and things, but I try to minimize those and really focus on, getting to the core of the problem and not just covering it up with a Band-Aid.
Mm.
And the opioid crisis has been terrible with fentanyl. It's now that fentanyl's been out in the streets, you can't even find heroin anymore. And fentanyl has
Right.
it's
Right.
very dangerous and
Yeah.
it's very high overdose rate. It's a little bit better. It's actually lowering now that the border is closing now. It's a little bit better because it's more difficult for the cartels to get it to America now because of the closed border. So we have seen a reduction of fentanyl deaths now, but still too many. Still too many people out there with addiction, and addiction simply means self-medicating. There's self-medicating an underlying problem.
Hmm.
A lot of street people are schizophrenic. A lot of street people are hooked on drugs so there's a lot of addiction and mental illness in the homeless community.
Hmm.
And so, because you can't really separate addiction from mental health, again, they tie right together.
Yeah.
You're not going to find an addict that doesn't have an underlying mood disorder that they're medicating.
Mm. Hmm. Hmm. Yeah. And you're right. Fentanyl is the new heroin. I mean, back in the 50s and 60s, it was that's what it was. Heroin. Then here comes the 70s and 80s. It's cocaine and crack.
Hmm.
And then here comes the 90s. In the 90s going into the 2000s, more people are becoming prescription drugs. It seems more people are becoming more dependent
Hmm.
on them as they've been advertised freely on television since I think 1996.
Hmm.
And today here in 2025, now it's fentanyl, um, and it has become a crisis, if you will,
Yeah.
a crisis. Um, but now, what we have now is you have something called the Corona Protocol. Now, can you explain what that is specifically and why people may want to consider going that route?
Well, because it's the most cutting edge way I've learned my methods. I basically taught myself how to do what I do, and I just the decision about based on the full history and and spending a lot of time with people. I don't rush them in and out. I spend enough time that I have to listen to everything that they have, and and so basically trying to fine tune medication to that person so everything is perfect. There's no side effects. There's it's all just positive results, and then combining things together and then doing it quickly to the point where I'm getting people feeling better really quickly. And then if you do that, then they have hope. And so basically the Corona Protocol is just my way I've learned how to do things, which is different. I haven't seen any other doctor or publication or book, nothing like what I've done, talked about out there because it's including modern textbooks. Because again, they don't look at things. A way of explaining is with psychiatry is they think about the brain, the mind, but they don't really understand the body. That's not their training. So when they don't understand the physical link, primary care doctors like me, you understand the body, but you don't really understand the brain link, and that wasn't really taught that well in our training. So I kind of put two and two together and figured out a lot on my own in order to start, writing about things and putting it on paper, and so yeah, and then over 2,000 pages of book later, after 23 years and six books, I just
Ah,
you know,
right.
have a lot to say, and there's a lot of detail in my books about, especially I mean the first three books with a lot of details and especially now the books I'm working on now, the training manuals for doctors, very very detailed ways of teaching doctors how to do this method and how to get people fully well in a very short period of time.
Mm.
It's a very innovative method again it's a cutting edge treatment plan because the way I do things is different than has been taught in the past.
Mm-hmm. Mm-hmm. Yeah, and yeah. So the Corona Protocol and certain uh, prescriptions that you use uh, to go at least faster than what standard psychiatry has people on certain medications for years. I've been on, for example, on Facebook. There's a lot of different groups or mental health groups, and I've seen a lot of people say, yeah, I've been on my medication. I've been on my Xanax or my Zoloft or for 10 years, for 10 years, 15 years. But when I come off of them, the anxiety comes right back. So, uh, do does the Corona Protocol get to the root cause of what's creating the symptom, or is it just kind of going to the physical chemistry of the brain imbalance or the
Well,
neurochemical imbalance?
it's both. I mean, it is because the medication basically balance the body, and so, and then again, if the person's on Zoloft for 10 years, that's fine as long as it works. I mean, but if they're still taking Xanax on Zoloft, it probably means there could be on there's something better that they should be on. But if they feel like, again, if someone's on Zoloft and says, I feel my old self, I feel amazing, I feel great. Okay, well that maybe that's fine. But there's probably he or she could be on a better medication, or maybe a combination of a couple that will get them to feel even better and get them off the Xanax too. But as far as the length of time, we just don't know. Because what I do is getting to the core of the problem. And so when you
Mm-hmm.
fix the core of the problem, and a lot of people, again, the reasons it happens, they have no control over. So that's why if you fix the problem and then sometimes you have to stay on them long term. But so what? They're not, they're not dangerous. They're, but so it's not like a cure, like you treat a pneumonia with an antibiotic and it goes away. It's
Yeah.
not that type of. It's more I guess you want to look at it more like a diabetes issue. It's more of a maintenance issue. Now,
Right.
if someone exception can be, let's say someone has no family history, no history in the past. They go through a really difficult loss of a family, a loved one, and they're grieving, and then a year or so is passing, and they're still having a hard time getting out of the grief, and so that's a person that I might treat and get them out of that depression, and then maybe continue for maybe 6 to 12 months, and then go off, and that might be all the person needs. So if the person doesn't have that strong underlying history where it's been going on a long time, it's more of a situational thing that set it off. That's someone who might be on things for shorter. And now, if someone has strong genetics, been feeling this way most of their lives, and now they're feeling great on whatever I have them on. Well, what's why go off of them? I mean, a lot of people say, "Oh, please keep me on these,"
Yeah.
or
Yeah. Yeah.
people try to go off of them, and then they come in and say, "Why am I not able to go?" I go, "Well, let's review your history and your family history." And I said, "This is a chronic problem with you, and that's why you're gonna. That's why when you take the medication away, those leakages open up, the chemicals start going the wrong way instead of the right way, and that's what you're feeling. Is you're so you got to keep taking these to get things flowing, keep things flowing better. So that's why I call it a cure, but it's a cure in a different way than when you might consider a cure and for other things. But like a lot of medical things we see are chronic.
Hmm.
Cardiac issues, blood pressure, cholesterol, a lot of things that people take longer term and don't really think too much about it.
Mm-hmm. Mm-hmm. Yeah. And matter of fact, because again, I was going through your website. Again, you got a lot of great stuff. Um, I was reading some of your testimonials as well, and I just want to read one of them here that I thought was really interesting. It says, and I'm going to just read it right here directly from your website. It says, I am a 54-year-old female. I suffered from severe generalized anxiety for many years. I had gone from antidepressant to antidepressant. Each one would work for a while and then peter out uh, to leave me shivering, shivering with anxiety once again. To anyone who understands what this is like, you get it. For others, even some doctors would say, well, you look okay. Dr. Corona understood from the first appointment what I was going through and gave me hope that finally I had found a permanent solution to my debilitating anxiety. Not only have I not had anxiety from about the second week of treatment, but I feel better than ever in my entire life. Can you kind of elaborate on that? And is that I mean, I know everyone's different, but is that what people can kind of look forward to?
Absolutely. I get really quick results. I move quickly. So probably, if people say to me, well, I've already been on these things, don't work for me. What have you been on? I've been on Zoloft, I've been on Lexapro. What happened? Well, they kind of work, then they don't work, or they kind of make me feel kind of apathetic and flat, and I just feel my emotions are not there. And so basically, when I hear that, then I'm not going to put the person on an SSRI. Every doctor does that. She's already been on two. Um,
Right.
so, I'm, so I'm going to put her on something better, like Prestique. My number one product is Prestique. It works also on norepinephrine, and then I'll add Wellbutrin, that which boosts dopamine, and that so the Prestique might get rid of the stress, the physical symptoms, but then they may still be tired and depressed, and I add the Wellbutrin in, and that'll get them out of depression, and so it's kind of like learning how to address each symptom so the person's fully better. And like this person's case, she never felt this good in her life, and so I love to see that happening. But because she's not used to, a lot of people aren't used to what a normal neurochemistry is like because they haven't experienced it, or it's been so long ago so they forgot how that feels.
Right. Yeah. Yeah. They don't even know what it feels like to feel good
Right.
on a regular basis or on a daily basis because they've been having this brain fog for so long or this body fog
Right.
for so long, and when they start to feel better, it's like, oh, the heavens start to come out, so that's great. um, I want to switch gears just for a few minutes. I want to talk about fibromyalgia because my mother was diagnosed with uh, she was diagnosed back in 2005. And she's had, she calls them flare-ups, off and on. She'll have these symptoms to where she feels these aches and different pain symptoms. And I've done some little research a little bit on fibromyalgia over the years. Can you tell us what is, I mean, I know what it stands for from a medical position, but can you tell us what fibromyalgia is, and what it does to the body, and how can we remedy the condition?
Yeah, so fibromyalgia, I call them one of the mystery illnesses, like IBS, irritable bowel syndrome. It's a mystery illness because there's no test for it. You can do blood tests, but normally if you start having body aches and pains that are scattered, the doctor will check for an autoimmune disease. They'll check for rheumatoid arthritis. They'll check for something that they can find on blood. Now, when everything is negative and the blood tests are normal, or maybe they do X-rays. Maybe they probably don't, but maybe they do. So they get the tests. So how many people have heard like, well, we don't know what's happening with you because all your tests are normal? How frustrating is that when you say, yeah, but I know I feel what I feel. What's the explanation? Well, the explanation is again the nervous system. The nervous system goes everywhere. Every little tiny piece of the body, the fingers, the toes, arms, legs, everything has nerve cells attached to it. And so when there's an imbalance in the system, and basically it affects where the nerves go to. And that imbalance is basically what's causing flare-ups of pain, and it's not visible with the naked eye, and so, but it's a microscopic thing again that's happening. So the way to treat it is, usually I look at norepinephrine first, which is, I use either Prestique or FX or XR, or some people have heard of Cymbalta. So these are, working on norepinephrine and serotonin. I start there. If that fully resolves it, great. It might just take one thing to resolve it. If it gets halfway better, then I add a medication that works on GABA, like Topamax, like gabapentin. So I look at those two chemicals the most when it comes to painful conditions, whether it's fibromyalgia or any of the physical, we call somatic or physical symptoms that are basically stress related. And again, the thing is, stress causes pain, and then pain causes stress, and then stress causes pain. So this vicious cycle. And an example of that is chest pain. So a lot of people, when they feel anxiety, has like tightness in the chest, heart racing. So what do they think? Oh my God, I have a heart problem. I'm going to have a heart attack. So they rush to the emergency room. They do a bunch of testing. All the testing comes out normal, and they go, it's just quote unquote just stress. Someone has headaches off and on, and they're thinking, I must have brain cancer because of this. So they go in and have a CAT scan done, and that's normal. So but there's got to be something that shows I'm not crazy. This guy's for real. Well, yes, number one, you're not crazy. Then people say, is it all in my head? I go, well, yes, it's all in your head because that's where your brain is.
Right.
And is it real? Yes, it's real. It's your brain. Of course it's real. And am I crazy? Am I psycho? Nope, you're not crazy. You're not psycho. So it's just getting past that and realizing that there's a reason these things happen. And basically the way of knowing if it's a neurochemical problem is let me try a trial of a couple of medications. I do one thing at a time. It might take me about 2 visits, maybe 1 or 2 visits to figure it out. And I usually resolve it really quickly. And a lot of doctors, again, most doctors are, just don't know what to do with that. They just don't know how to treat it. So what do they do? They'll treat with symptomatic medications, anti-inflammatories, muscle relaxants, pain pills. They'll treat the surface but not get to the core.
Right. Never getting to the core. It's basically the surface scale, but never getting to the underbelly, if you will.
Right. Exactly.
The underbelly. You mentioned Cymbalta and other medications that
Mhm.
people have kind of feared a lot because of some of the things that we've seen or experienced or we've heard in documentaries and whatnot. Again, in my brother's case, he was put on some of these medications as well. Um, and again, just for people to be comfortable or more open, if you will, because some people are fearful of becoming addicted to a Cymbalta or a Lexapro. But what you're saying is that because you have a more of a quicker guideline to get to attack what's going on right here at the surface, and then to where we don't have to worry about any type of addiction to any of the medications. Now, if someone has been on Cymbalta or Seroquel or any of the various medications, how can one wean themselves off? Because a lot of people fear the the after effects of trying to get themselves off of the medication so their bodies can kind of function on their own versus going through all of the oh gosh, the word is on the tip of my tongue right now. When they try to come off of certain
Withdrawal.
medications, the
Withdrawal.
withdrawal, there you go, the withdrawals. More people are fearful of the withdrawal symptoms
Hmm.
more than they are of taking the medication themselves.
You're
So
right.
so how can one be reassured that they can come off without any complications to their physical body?
But the thing is, if they're having problems coming off of it, that means your body's telling you, what are you doing? Why are you trying to go off of this? And so, because again, they're not addictive. So Malta is not addictive. Again, what are you going to say to the diabetic? Say they're telling you, well, how can I get off this stupid insulin? I've been shooting this to myself most of my life. And why are you going off your insulin? Because I'm eating better. I'm exercising now. I'm no, but that's different. You have diabetes, so it's the same. I equate to diabetes. There's no addiction to that. No one would accuse a diabetic of being addicted to insulin. In the same way, you're not addicted to Cymbalta. Now, again, it depends if it's working. Now, if something's not working for you, by no means, by all means, go off of it. I mean, but if it's working and the person's feeling really good for a while, and then they try to go off and they feel bad, again, it's the body telling you it's not your time. It's not time to go off of this yet.
Mm-hmm.
Now again, it's if something, like with schizophrenia, it's very common. What happens is the antidepressant will make them worse. It'll make them more psychotic. It'll make them so if that's happening, then basically it's a misdiagnosis. You got to pull that antidepressant away. You got to focus on the mood stabilizer, like Seroquel, like other things. And so yeah, so it depends on the diagnosis. It depends how long. Like for example, paranoid schizophrenia. That's a chronic condition. He should never ever go off medication. Period. End of story. That's just a recipe for disaster. And so yeah, a lot of people just have to kind of come to grips with, hey, this is just a medical problem with a medical solution. And it's very important. And I tell my patients this is extremely important, where to get medical information from. There's three sources I tell people you never get medical information from. Number one is the internet. And everyone goes on the internet to get information. It's a terrible place to do so. There's a lot of scary information. There's suicide warnings. There's all this stuff that makes people suspicious, like, oh my God, the doctor's hiding something from me. They didn't tell me about this or that. Well, it's because it's ridiculous, is what it is. So the websites are terrible. But even if it's a medical one, it's all government related, FDA approved material. It's all lawyers and all that. So the internet's bad. Number two is family and friends. Well, of course, you don't want to get medical advice, but people do. They'll ask, oh, my cousin takes this. Can I have this? Or,
Yeah,
you
yeah.
know, so that. And number three is the pharmacists. The pharmacists, they should not give medical advice. They're not doctors. They fill prescriptions. They understand medication, but they don't understand how to apply them. They don't understand how to prescribe them. They don't do that.
Mm.
So it's basically it's just a matter of understanding the getting medication, getting information from the right source, And that's why I've written my book, so I give people very clear information about all this subject, and about why is it hard to get off of things when your body wants you to be on it, because it's when you try to go off something and force your body off something that it wants you to take, the imbalances just go right back again. So again, it's different than a cure, like I said before, where you take something for a few months and then you stop it and everything's fixed. It doesn't
Mhm.
work like that in this field, and people have to just get used to and get comfortable with that. That's all.
Yeah.
You know.
Yeah. Yeah. And with some other symptoms, we hear about fatigue and brain fog, as I mentioned earlier, which is becoming more common. Brain
Mhm.
fog, fatigue. Um, you mentioned insomnia as well. So all of those can be remedied as well. Maybe not with the same type of medication, but they can be remedied over time, as long as as long as the patient comes to you with all honesty and telling you what their symptoms are,
Mhm.
because we do hear a lot about fatigue, and people are insomniacs. They can't sleep. They're only getting maybe 1 or 2 hours of sleep because they're thinking about all the worst case scenarios. I got to get up and go to work tomorrow. I got to do this. I got to do that. I have these timelines. Um, and it is a stressor.
Mhm.
They're stressors. Can those be remedied as well?
Yes, absolutely.
Okay.
Yeah, I think, but again, when to get into the stressors, this is where also some therapy might come in too. And but some people just need the right medication combination. And when they tell me, you know what, the same stressors are going on in my life, the same boss I hate, the same this, the whatever, the same things are happening, but I can handle it better. It just doesn't affect me the same way. It doesn't get to me as much. So I feel stronger from within.
Hmm.
Um, so I hope that did that answer the question?
Yeah, 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 yeah. Absolutely. Um, and before I go to, because I want to talk about, you talk about physical activity versus exercising, because I think that's very, very important for people to have that. Being in
Yeah.
personal training myself, I always stress some form of physical activity. Before we go there, you, because we've talked about the mind body connection and the brain, um, are we capable of, or is the mind and brain capable of coming back to a harmony or homeostasis, without medication? Is that possible?
If it's well, forget it. I mean, there's something I didn't answer before, about sleep and fatigue. Yeah, so I'm
Mhm.
not satisfied until someone is sleeping like a baby.
Okay.
Well, not a young baby. Uh, Sleeping like a baby, good energy. I focus on all of those things.
Yeah, yeah, yeah.
As far as when it comes to neurochemistry, if you have imbalances, they're not going to fix themselves.
Mm.
So a lot of people basically, actually, the vast majority of people are going to live their whole lives never feeling any kind of a relief from their problems. Why? Because they never seek treatment, or they live in an area that there's no doctor available that has this treatment available. And think about not just around in the United States. Think about around the world.
Oh
What,
yeah.
tell me
Oh yeah.
about some of these countries where they don't have modern medicine. What do they do there? They suffer.
Hmm.
So this is a worldwide problem, and it's just, and then again, I live in an area which is, in Orange County in California, that's pretty high tech stuff around here, but the people who live in the out in the country, or live, where they just don't, it's not easy to get access to care, and especially, care from people who really understand the subject. This is what's driven me to write my two books I'm working on this year, is because I have this desperation. I need to get the word out about this and educate about this,
Hmm.
and to understand that, look, it's not as scary as you think it is. It's, these things are treatable. They're in safe, effective ways, and it's tough. What you're describing, it's not easy to get to tell people you should be on these for a longer time. And how long, I'm not sure yet. But just the best is to not question it now, and stay on them. And sometimes they fight me on it. Sometimes they want to try it, and I say, okay, if you're going to try it, here's the way to go on it, off it. And then they almost
Yeah.
always they come back to me and say, okay, you're right, I shouldn't have done that. And I go, well, at least now you know. For some
Right.
people, they have to do it once or twice just to show themselves that it's still necessary.
Hmm.
Because people take it for granted, like, well, I feel so great now. Why, I go, well, maybe you're feeling great because you're taking this or that. Well, yeah, but I don't. I think it's because my situation's improved, and my boss I have a new boss now, and he's wonderful. And okay, great. Well, if that's the case, everything's improved in your life. Let's try. Let's try going off it slowly, and let's see what happens. And sometimes it works.
Hmm.
Sometimes you get that major stressor, and the person, and it works, and sometimes it doesn't work. And then they say, well, why didn't it work? My situation improved. I said, well, because you still have the genetics, you still have the underlying factors that are working against you, and this medication or this combination is basically putting you in control, and it's beating the genetic factors. And it's just this is the normal state of being. We call it remission, means feeling completely well, feeling yourself. Uh,
Hmm.
and that's sometimes we have to figure out what that is for certain people who've never felt themselves. They never felt good. You know,
Yeah.
their normal is sadness. Their normal is anxiety their whole life, and they don't know any better.
That's right. Yeah, and I'm glad you mentioned that it is a global thing. I interviewed a physician from Scotland, and put she built the first uh, medical facility in her area in Glasgow, where she has standard allopathic medicine and alternative or naturopathic medicine as well. She kind of offers both, but it was the first in her area in Scotland, because they had never had any type of facility where people can have access to any type of remedy,
Right,
standard or otherwise,
right,
you
exactly.
know. And even here, like you said, some people just don't have the access.
Yeah.
They don't have the access. Um, you're not too far from where I am. You're in Laguna Beach or Laguna Niguel.
Where you at?
Okay. Oh, I'm just south of Los Angeles. I'm
Okay.
in. Yeah, yeah, yeah. So yeah, you're not too far. I've been in Laguna Niguel a few times, and so it's great that you have provided a facility where people can have access, so they can feel that they can have some form of remedy,
Hmm.
so they can get this monkey off their back once
Yep.
and for all,
Yep.
and not have to prolong the symptoms for 6 months, a year, and in some cases, like I mentioned earlier, 5 years, 10 years, you've been on the same medication, and they can start to feel like nature intended for them to feel
Mhm.
happy, and have a sense of joy within. Um, Before we wrap up, I want to go into the physical activity portion,
Mhm.
because and I'm going to go right here to your I'm going to go back here to your website, because you mentioned how people and how there's a difference between uh, being physically active and exercising. So, can you differentiate the two, and what can we do to kind of uh, enhance our physical selves, so we can kind of so we can heighten the healing process?
Well, physical activity meaning just getting out, being with friends, socializing. Not getting stuck at home and depressed. And so it's great for mental health to get out there, network of friends and families to support you. Physical health, I mean, the physical part though, also the exercise is different. Exercise is different than dog walking. Okay, dog walking is good as walking,
Yeah,
but
yeah.
cardiovascular exercise is where you, after a half hour or so of it, you're huffing and puffing, you're sweating, your shirt's wet. That's the type of exercise that really helps to reduce stress and helps promote health. What I've done for, man, I don't know how many years, probably almost 30, is I walk every morning at least 3 miles, power walking every morning, 7 days a week, often on the weekend 4, sometimes up to 6 miles. So
Mhm.
for me, I'm a walker. I don't go to the gym. I'm a cardiovascular guy, and that's how it's a great way of blowing off steam. It's a great way to time of thinking about things when you're exercising, and so yeah. So just being in whatever else, people join the gym. That's great. Pilates, whatever. I mean, whatever you're into, yoga, meditation, whatever you get into that's promotes physical health.
Mhm. And can uh, exercise, and just to kind of reinforce, uh, can physical exercise help to reduce stress or depression or anxiety?
Absolutely, yeah. It's great for stress. But again, it's great for stress, and it's good for the body physically, or your just overall general health. Is it enough for a lot of people? No, but at least it's something. I mean, at least it's something it's no matter what I do with medications or what I still tell people it's still important that you do this, and find the time in your day to just be regular with this. Maybe it's not every day, maybe it's 3 or 4 days a week. Great, whatever it is, whatever you can do. That's you work on your health, work on your physical health.
Now, in conjunction with medications, do you recommend any natural supplements to go in conjunction, or should you stick with one or the other?
I think the natural stuff it doesn't work as well. You got kava, you got like 5-HTPs, St. John's wort, SAMe, GABA. There's a bunch of over the counters. The problem with them is they're not addressing the problem. They're adding serotonin to your system, and that's not the problem. You don't have a lack of serotonin; it's imbalance, and so they're not
Right.
really addressing the problem. So that, I haven't seen them make a huge difference. I mean, if someone wants to continue them, that's fine. If they think they get some benefit, great.
Uh-huh.
Or I tell them once I get you feeling really good, what you can do is like pull those away and see if they make a difference now. And if they do, go ahead, put them back in. And if they don't, keep them out.
Mm-hmm. Mm-hmm. So walking, I think walking is a nice brisk walk, 30 minutes, maybe even an hour if you have the time, just to raise the heart rate, just getting out in amongst the atmosphere,
Yep,
and just kind of taking your mind off of the stressors,
yep, yep.
taking your mind off of the stressors. Um, you've given some great information, Dr. Corona. I just want to thank you for taking the time out to explain all of this, because like you mentioned earlier, people are kind of iffy about, should I take this? Should I take that? Um, will I become addicted? Will it work? Will
Yep.
it not work? Does he know what he's talking about? You hear
Yep.
all of these different, and I've heard them too over the years. I've heard them too. Um, so I'm glad that you've kind of explained, to kind of ease people's, uh, um, you know, um, fears, if you will, for lack of another term, or any type of fear, or any type of something that they believe will cause some extra adversity to their
Yep.
lives.
Right.
And because a lot of people are apprehensive
Hmm.
about going that route, so I'm glad you explained it much better than I could. Um, so thank you for that.
Well,
Can
and
you? Yeah, go ahead. Go ahead.
if anyone has a problem finding a doctor, I'm available. I see patients from all across the country. Because what I do, we can talk on the phone, we can do it Zoom, but I'm available. If you go on my website, drpaulcoronamd.com, so drpaulcoronamd.com, and really quickly, you want to reach me on X, Instagram, and TikTok. My first 3 books, Healing the Mind and Body, the trilogy, are available on Amazon, and the Corona Protocol is on Amazon, Barnes and Noble, Walmart, and now it's also on Audible. An audiobook is on Audible. And so, been on my website. Oh, and my TV show is doing really
Oh yeah,
well.
yeah, 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 yeah.
It's in its third season, and we're crushing it.
Yeah,
So
talk
it's
about
on
that.
it's on Roku. It's the Dr. Paul Show. So
Yeah, yeah, yeah.
the Dr. Paul Show. It's on Roku. It's on Amazon Fire and YouTube. Now, there's a lot on YouTube that's not on the network. On YouTube, it's blowing up. I've almost like 30,000 views, over 1,000 a week, new ones. To find it on YouTube, you have to specifically put the Dr. Paul Show, all lowercase, all stuck together, no spacing, no period. So THEDRPAULSHOW. So if you put it in all like that, you're going to see in my YouTube channel a lot of stuff on there. And if you want to look up Samantha's case, her case has gotten so much attention that we're going to be doing like a 3-hour documentary on her. And so yeah, it's been really busy, but but even no matter how busy I'm at, I always take time to see patients, and I'm always taking new patients. So if anyone's interested, my office number is 949-481-0118. You can contact Leslie, and we can set it up.
Thank you for telling. I was going to ask you about all your information, but you just summed it up. and here you are. This is one of your episodes of the Dr. Paul Show. Yep. So definitely check him out. And you said it's on Roku, correct?
Yeah, Roku, Amazon Fire, and YouTube.
Roku, Amazon Fire, and YouTube. So yeah, definitely check out Dr. Paul and go to his website. He has a lot of information on there, a lot of testimonials. I read some of your blogs as well, which is how I found the one about physical exercise. Great information. So thank you for that. And thank you for, again, taking the time out. And I'd love for you to come back, and because we can kind of deep dive into some more of these anxiety disorders, bipolar. I did a whole series on ADD and ADHD earlier this year, or late last year. So yeah, we can definitely kind of go deep diving into all of those.
I'd love to come back on. I can talk about any subject endlessly about any of these topics, and so I'd love to come back on whenever you'd like to. Whenever you want.
Absolutely. Thank you so much. And we'll put all your information when I go into post-production. I'll put it all up on the screen so everybody can contact you, to kind of get some of this great information and remedies as well. Remedies, because no one has to be bipolar or identify themselves as having bipolar. When you meet certain people, it's one of the first things that they say, oh, I'm such and such, I have bipolar, or I have this or I have that, and they identify themselves as that. It's like it's their middle name.
I tell people, you aren't the illness, you have it. That's not defining you. That's
right.
So
right. Yeah, I agree with that wholeheartedly. So thank you. Check out Dr. Corona, Dr. Paul Corona. I want to thank you. And to everyone listening and tuning in, once again, go to my YouTube channel. It's the Kinetic Hour, KENNETIC. Leave your comments. Contact Dr. Corona. He's great. I want to thank everyone for tuning in. There's 1,000 different podcasts that you can be listening to. So thank you for tuning in to the Kinetic Hour. And until next time.